Hello everyone, I'm Urologist Ömür Erdem Akkaya. The subject we will talk about today will be the degree of erectile dysfunction, such as mild, moderate and severe, and the exact definition of erectile dysfunction, where the person should position himself and what direction he should proceed. Because erectile dysfunction is exactly the condition in which the penis cannot become hard enough to have sexual intercourse, or the penis cannot maintain its hardness during sexual intercourse. This second sentence is very important. Why? Because many patients can come to me and say, "Doctor, I do not have erectile dysfunction. When I have intercourse, my penis deflates in the vagina." Or, "Doctor, we start intercourse. I ejaculate early." They may come with such complaints. If premature ejaculation begins to occur in a person after a certain age, it has been revealed in many scientific publications that 50% of these people have erectile dysfunction. At the same time, the inability of the person to maintain his hardness during intercourse is the full definition of erectile dysfunction. What is important here is whether this erectile dysfunction has developed over the years or suddenly. Because if erectile dysfunction develops gradually over the years, the person develops an adaptation to it in some way. He makes modifications in his sexual intercourse. Since these changes also occur in the partner, the person can adapt to this situation. But if this condition occurs rapidly, it can also affect the person psychologically. Even if mild erectile dysfunction has developed, it suddenly affects and changes the person psychologically, sexually, and in terms of couple relationship. When a patient comes, we ask questions to evaluate his sexual satisfaction, erection quality, general sexual pleasure and happiness, especially in the last month. When necessary, we ask the person to rate these through surveys. The purpose of rating is both to evaluate the changes in these results if another doctor will see the person in the follow-up, to evaluate the results of the medications, and to determine the degree of erectile dysfunction of the patient as mild, moderate, severe. Because in patients with mild erectile dysfunction, it may be possible to treat the patient with different treatments at lower doses, but with more radical solutions in patients with severe erectile dysfunction. As I said, the definition of erectile dysfunction exactly is the inability to maintain the hardness of the penis and to continue intercourse. If you have any questions to ask, you can reach me on WhatsApp. Thank you for listening, regards.